we do. So this webinar is brought to you by Keper Institute. This is the training provider in Singapore, providing EFT training and education. I am the founder and also a practitioner, and I'm passionate about spreading and educating and practicing EFT in Singapore. Today, we are very fortunate to have Dr. Catalina Woldarsky to join us and to help us learn about self-soothing in couples work. She has a doctorate from York University under the direction of Prof. Les Greenberg, and she has extensive training in EFT for individuals as well as couples. And she is a trainer and a supervisor for therapists learning EFT internationally. Her research is focused on understanding how forgiveness unfolds in couples. And if you're interested in forgiveness, please look up this book published by APA in 2019 on forgiveness and letting go. She's originally from Chile. She's now based in Switzerland and works in private practice, also teaching in a graduate counseling program at Webster University. So thank you very much, Catalina, for taking time in your somewhat cold morning to join us and to help us learn.
Brilliant. Well, thank you, Ingrid, for the invitation and to Caper Institute for hosting this webinar. The program is such that I'm going to be presenting for about 45 minutes on the topic of self-soothing. And then we're going to have a period of question and answer. And then Ingrid will tell you more about upcoming trainings through the Caper Institute on emotion-focused therapy for couples. So if you are looking to get trained in this model, we've got an excellent opportunity for you coming up in January. But without further ado, here we are. Let me get going on this topic. I also just want to say hello to some of my colleagues from Switzerland. I'm seeing Petra is on the call, and she's a dear colleague, so that's wonderful. All right, so today I want to talk to you about a particular aspect of emotion-focused couples therapy that's actually unique to the Greenberg and Goldman approach. So some of you may have been present for a webinar I gave in September where I talked about the distinction between the EFT-C model as offered by Sue Johnson and her colleagues versus Greenberg and Goldman, where I highlighted that one of the key differences is actually the emphasis on working on individuals, meaning helping people understand the concept of identity. Whereas Johnson talks exclusively about attachment, we're also talking about identity here, attachment identity, and also the emphasis on helping individuals develop the capacity to soothe their own emotions. So this is what I'm going to focus my talk on for today. So for those of you who are brand new to this model, let me give you a very quick overview of emotion-focused couples therapy. So this is a model that was originally developed back in the late 80s by Les Greenberg and his then student Sue Johnson at the University of British Columbia in Canada. And it's a humanistic approach that actually integrates elements of systemic therapy and experiential therapy. And so the understanding is that couples operate as systems and that these systems are self-reinforcing. And it's the expression of emotion that sustains particular interactional dynamics. And so when we work from this lens, we're using emotion to change the interactional dynamics. And we're focusing really on what's happening in the here and now. This is what makes it experiential, and emphasizing the process of how partners are, interacting with each other rather than the content of what they're saying. Okay. And this is actually what makes the dynamic come alive in the room. And essentially, we're helping people move, or the understanding is that when couples are in conflict, they're often expressing what we call secondary emotion. So they're expressing a lot of reactive protective emotions, right? Typically anger. So one partner will, be more attacking, and that will invite probably some defensiveness on the other side or some counter arguments, and then they'll get stuck here. But if we can help these two partners move from expressing secondary reactive emotion to actually revealing what's happening underneath for each of them, and that is typically the more vulnerable feelings that they don't typically share in conflict, then it invites a new type of response. So this is what this theory is all about, or this model is all about. And like I said previously, Greenberg and Goldman are really interested in actually working with the dimensions of attachment, which is the need for closeness and connection, but also identity, which is promoting the sense of self within the relationship and the need for validation and self-esteem. And so what we need to do as therapists is help couples move from these kind of unconscious attempts to manage difficult situations, right? So people, when they're in conflict, they either typically attack or withdraw, some version of this, right? And what we understand these to be are essentially survival strategies. So this is what partners have learned to do in life to defend themselves. If we can create enough safety as therapists, and we do this through a lot of validation, a lot of validation and understanding. I mean, and the frame is really essential. So what we understand is that both partners are in pain and they're doing their best to regulate this emotion. So there's a strong emphasis on emotional regulation. Like people are doing their best to manage the feelings of inadequacy that may come up, or fear of abandonment or rejection or whatever more vulnerable, delicate feelings come up when they're in conflict with their partner. And even though it may look completely counterproductive to you, what they do in their interactional cycles, which means the positions they take in their interactional cycle, whether it be one is more pursuing, the other one is more withdrawing, or maybe it's an influence-based cycle where one is more dominant and the other one is more submissive. These are just attempts to manage whatever is overwhelming them internally. But if we can create enough safety, right, if we can see beyond the more reactive layers, but we need to acknowledge them and recognize that, yeah, you just feel so, angry right now because it's so infuriating to feel unimportant, right? And I understand that underneath there's a more delicate part that feels unimportant in your partner's eyes, and that's really painful. So if we can start moving couples into getting interested in their internal experience, and we can promote the expression of vulnerability and have their partners respond constructively to these expressions of vulnerability, then a new type of interaction is possible. And in some ways, they can kind of put their arms down, right? I've got a picture of this woman firing her arrow or just about to fire her arrow, right? Because now a new type of interaction is available to them. So there's a lot, I mean, there's just so much to be said about the power of vulnerability. We know that authentic vulnerability of sadness, fear, or shame evokes compassion and bonding within the partners. And we also know that assertive anger in the context of what we call identity-based cycles, so influence-based cycles, where one partner is being dominant and the other one is feeling crushed by the weight of this. In that situation, it's less the vulnerability that comes out. It's primary emotion and it's primary anger. So we need the submissive person to be able to express primary anger to the dominant one for the interaction to change, just like we need the dominant person to reveal what's underneath their dominance, because that's just one layer of what's happening. And dominance is a whole other topic, but almost to say that there is so much available when couples and partners can relate to each other from a more vulnerable place. and new types of interactions are available. So positive feelings emerge, and these are so important because they buffer or they add resilience when couples are in conflict. So they inoculate against conflict. We're trying to move not just from having couples express negative, kind of destructive emotions or having destructive interactions to promoting bonding, to promoting opportunities to actually get close together and feel understood by each other and feel supported by each other. Okay, so that's what vulnerability allows. And there's a world of literature on the importance of vulnerability. I invite you to check that out, including the work of Brene Brown, right? And the courage to be vulnerable. Um, Vulnerability is the transformative element of this model. Okay, so the change doesn't happen through new behaviors or us coaching people as therapists to, do things differently, meaning behaviorally to go on dates or to go do this or go do that. The change happens experientially, internally through the awareness that there's a more primary feeling underneath the reactive layer and through the capacity to reveal this to the other partner. But this is really the crux of the whole therapy, but we're actually emphasizing this at stage 3. Okay. So I want to make it clear that timing is everything. This is a 5-stage model. And what I've just presented to you is kind of like the summary of like, this is the essence of EFT-C. We're going to help partners access their vulnerability, express it to their partner, and promote a responsive or an appropriate response from the other one. But we don't do that right away. This is a 5-stage model. In the first stage, we're working on validating both partners' pain and actually trying to understand the difficulties that they bring in through the lenses of attachment and identity. We're obviously really emphasizing the development of a safe therapeutic relationship, and that's something that we continue to assess and be attuned to and really, and be really attentive to throughout this therapy. But stage 1 is really creating that safety, developing a strong therapeutic alliance with both partners. Stage 2 is about trying to get them from this reactive place of escalation to having that de-escalated so that we can then move into vulnerability. Okay. So with negative cycle de-escalation, depending on how should I say, how stuck the couple that you're working with is, this may be where you spend a lot of time in the therapy, and it consists in initially trying to track trying to identify, so what is the cycle between these two people? So what are their positions in the cycle? And we do that initially behaviorally, actually. We get a definition of who does what to who. Okay, so this one attacks and the other one defends. Or I'm seeing that this one, whenever they talk about this issue, this one gets very agitated and that one shuts down. Okay, and then I first need to understand what's happening in front of me. And then I kind of take the role of an empathic detective to try to sense into, I wonder what vulnerable feelings this may be touching. And maybe, we'll start exploring that. And I may start, asking deliberately, I wonder if what I'm seeing the anger that comes up so intensely. And I'm curious about kind of what else might be going on for you. Or I start to conjecture into what that might be. Conjecture is just another term for suggest, right? Empathic conjectures are really the most common forms. This is the most, it's a form of empathy that we use both in individual EFT and in EFT-C for couples, but it's really the dominant mode of empathy we use with couples. And it consists in actually attending to whatever elements are available in front of me right now that may suggest there's may be some other emotion here. So it may be that one person, one partner is complaining and there's a lot of anger in the things that she's saying. And maybe there's something about her face or her eyes, right, that suggests to me it looks like there's something sad about this as well. And so I'll use that information and I'll frame it as a question and I'll ask this partner, and I wonder if maybe there isn't also some sadness in here for you. Does that resonate? What's important about using empathic conjectures is that you have to follow them up with verification questions, right? Does that resonate? Does that make sense to you? And you also want to make it clear that it's coming from your frame of reference, right? This is not me defining the person and saying, you are so sad, right? This is me opening up an exploration. And it's easier to have something that people can actually use as a kind of a place of verification. Is it sadness? And then she can check and say, well, no, not sadness, it's more disappointment. But it gives a starting point to the exploration. So the emphasis isn't on I have to be right. The emphasis is on let's get this exploration going. And so in stage two, I, as a therapist, I'm trying to identify what is going on underneath for each of these partners, right? That actually underlies their positions in this negative interactional cycle. So that the more one attacks, the more the other one gets defensive, right? Or the more one is agitated, the more the other one kind of pulls away. I've got to figure out what else is going on. And so we spend a lot of time here at stage two naming what that might be. And so for one partner, it might be a deep sense of sadness, feeling disconnected. And maybe in the other partner, the one who's more withdrawn or shuts down, maybe it's more a feeling of inadequacy. And at this point, I'm naming it, and I'm making the link very explicit between, so when you feel so inadequate, like you just don't know how to reassure your partner, it's like you can't help but do anything else except pull away because it's so painful, because you feel so inadequate or you feel so hopeless, right? And it's that kind of hopeless feeling or that stuck feeling or that sense of inadequacy of I can't quite get this right and I don't know how to make my partner happy, that actually kind of prompts you to pull away. And the more you pull away, the more you, other partner, feel really kind of abandoned, right? And you kind of come up with more energy to say, come back and let's finish this argument. And underneath, though, I understand you're actually feeling quite sad. Over time, you do this enough times. I mean, once is definitely not enough because this is a frame that we as therapists, and certainly in the training, we emphasize a lot in terms of how you do this and your role as this empathic detective. It's a process, but eventually, what's phenomenal is that it starts to shift. And suddenly the couple moves from blaming each other to actually listening to, what might be going on for my partner? And it's really wonderful to see, but that's only the first part of the change process. So when people are de-escalated, when they're actually interested in what their partner's internal experiences, we move into stage three work, which is accessing underlying feelings. Okay. I'm really emphasizing the order of things here because I'm going to talk to you about self-soothing, right? But I want you to understand we don't do self-soothing work at the beginning of the therapy. Self-soothing work comes later. After cycle de-escalation, we access underlying feelings. And this is a really active phase of therapy as well. So, for therapists, this is not called sit and wait for vulnerability to surface. This is called access underlying feelings, which means that you as a therapist have to use your empathic superpowers. And usually this is where we use a lot of evocative empathy to turn up the volume and make this vulnerability come alive in the room. Because, as I said earlier, this is an experiential approach. So people have to see the vulnerability in their partner's face, so to speak, or experience their partners being vulnerable in order to have a new type of interaction with them. Otherwise, it's just a cognitive kind of understanding of what might be happening for them. Then, and only then, do we move into stage forward, which is around restructuring the interaction and the bond. And this is where we start to use enactments. So this is a particular intervention where we have the vulnerability activated, and then we invite partners to turn to their partner and share it to them. So now they're not telling me about their deep sense of shame and inadequacy. Once I have that activated, I'll say, and can you turn to your partner and can you look at him? And can you see if you can put words to that feeling of inadequacy that you've just named for me, and tell them what it's like for you to live with this in these moments? And it becomes very deep. And then I'm inviting very actively expression of vulnerability. And then I'm also wanting to ensure that the other one is responsive to the vulnerability, right? So we have to have both. And sometimes there are blocks. And in the training, we talk a lot about how to handle blocks, meaning either one person has difficulty revealing vulnerability or the other one doesn't want to. I mean, typically what happens is vulnerability invites empathy, but sometimes that's not how it goes. And sometimes you have one person being very vulnerable and the other one being either indifferent or rejecting, and you've got to deal with that. And then another thing that happens in stage 4 is self-soothing work. So self-soothing work, notice, comes towards the end of therapy. Okay? Big red arrow to signal to you, don't do this at the beginning. Okay? Self-soothing work, which I'm going to tell you about in a second, is the emphasis is on developing the capacity to soothe oneself when one's partner is not responsive. And that falls in stage 4. And then stage 5 is around consolidation and integration and helping the couple move forward with, this tremendous change that's happened in their relationship. So let me quickly say a couple of things about self-soothing before I show you a video. It sometimes happens that one partner has difficulty feeling soothed by the other partner. So we're always emphasizing other soothing first. Okay, I want you to have that very clear. So we are moving through the model, vulnerability and responsiveness to vulnerability. Once that's happened, we may come across a situation where, despite getting all sorts of, reassurance and validation from the other partner, this one partner doesn't feel soothed. And this one, it might be that one partner remains feeling really insecure. And it's at these times when we're going to promote the capacity for self-soothing, right? It requires that the partner be able to tolerate, basically, I mean, I think it's beneficial for everybody. And there's currently kind of a move in the field to do self-soothing, even when for both partners, right? As a kind of a part of the therapeutic work. But let me just talk more about the situations where one partner is consistently feeling still unsafe or still not reassured, or these feelings of shame continue to be so persistent. Usually this is because that person has had some traumatic experience in their life, and there's a deep, what we call them emotion scheme, right? Or this person is really deeply organized either around shame or fear. And it doesn't matter how many times the other partner says, I'm not going to leave you, or I really am here for you. And it doesn't matter how loving they are, it still feels, right? Like that person may leave. The fear is really real, or the sense of being unlovable is so deep. And so it's in these situations where we're going to promote self-soothing. And self-soothing is about helping people develop the internal capacity to comfort themselves. And it's a form of emotional regulation that needs to be used when the partner is not available. It needs to be used, I think, as a life skill, because even if your partner is around, there may be a moment where the partner just can't, for whatever reason, be the responsive, soothing other that this one partner needs them to be. And so people need to be able to regulate themselves. And this is a fundamental difference, again, between the Greenberg and Goldman model of EFT-C and Johnson's model of EFT-C, where Johnson promotes exclusively other soothing. Here we're saying, yes, we definitely need other soothing first, but we also need to give clients, so both partners, the capacity to self-soothe. Self-soothing is not relaxation and nor is it avoidance. It's actually a very active way of generating compassion for one's wounded parts. And the ultimate objective is to transform shame, right? Or fear. I've put shame in there because that's kind of the more common one, but it could also be the fear of being abandoned. And the way that we do this, you're going to see this in a video in a second, is that we first need to, again, be really clear on the timeline of where we are in the therapeutic work. And if we've already had the responsiveness from the other partner, now we're going to invite, and we see that even though that's there, they're still feeling not reassured or unlovable. And so we're going to explicitly present this as a task for therapy, right? And you'll see this in the video. The therapist says something like, we come back to this place and maybe it'd be important to actually deal with this wound, so to speak. And we engage that one partner. So we're actively working with one partner around their internal sense of feeling unlovable or their fear of abandonment, whatever it is that whatever the chronic maladaptive emotion is that's constantly coming up. That's what we're going to work on. And one partner, we work with one partner at a time, and the other partner is observing. Okay, so we get consent to doing this work. And I usually say, so, given that this is, the place where you often get stuck, or I can see this is just, it creates such suffering for you, I'm going to suggest we do this work with that wounded part, and you, other partner, if it's okay, right, you're going to be more in the observer mode today. And they usually, say, okay, that's fine. And then we move into working with the inner child. And so the inner child is a way of, and again, it's like, which inner child? Well, you've got to identify kind of the origins of when this wound developed, so to speak, right? Because there are different ways of doing this. But this is a task, actually, that comes from trauma work. It's the re-experiencing task. And so you identify a moment that kind of encapsulates the origins of the wound, so to speak, or it's like that was when it's kind of like the moment that really encapsulates the suffering for me. And we invite the person to make contact with that younger version of themselves. And we spend a moment creating contact because this is experiential, right? And so we want to actually allow the vulnerability to emerge. And then we want the adult self to offer whatever unmet need the child needed but didn't get. And usually this is very evocative. You'll see it in a second, right? So the adult, usually already it's quite an evocative task, right? And there's usually a lot of emotion that comes up, and we get the adult self to, relate to this inner child and imagination, and the adult offers the unmet need. And then we shift focus and invite the adult to take the perspective of the child and to feel what it's like to have that need met. And then we allow and accept whatever it is that's come up to be there, and process it. And this is a very transformative task, right? Because we're basically, again, to go back to the basic EFT concept, we're changing emotion with emotion, right? So we've got somebody who is initially connected to shame, and now by virtue of attending to the unmet need, a new emotion arises. So we've just had this really profound shift that's happened, and then we want to integrate it with the other partner, right? So we've got a witnessing partner who's part of this work, even though they're in a more passive stance. This is so important for them to have empathy for their partner, and also to recognize that this wound is getting activated underneath whatever the secondary reactive position that their partner takes. So I want to show you a video now of self-soothing work with a client named Alex. And in her cycle, she's the pursuer. She's seeking closeness, right? She uses this metaphor of the bridge. Like, I want you, the husband's name is Kim, and they're in their 30s. They have two children, and they're in therapy. This is stage 4 work. So they've managed to get Kim to come closer because he usually shuts down. So now that Kim is more attentive and coming closer to her, what comes up for Alex is a deep sense of feeling unlovable, and she's actually pulling away from him. Her core shame is rooted in the father's abandonment, which you'll see this in the video. The parents are divorced, and the father left the mother, and she was raised by her mother at age 12. But essentially, the father moved to a different country almost overnight and never kept contact with her. So she carries this deep sense of rejection and being unlovable. And the therapist engages her to do this work with their 12-year-old self, which is the time when the abandonment happened. So we've seen this whole transformative piece of work. And now we want the partner to respond to her pain, and he does. And it's a really, it's a bonding experience. So self-soothing is so important to promote the capacity to take care of oneself, but also it strengthens self-worth. It reduces shame and it enhances the bond. And Tanya Mo Thompson, the therapist you saw in the video, is actually doing research in Norway with qualitative interviews of real couples who've gone through this task and asking in particular the witnessing partner, what came up for them. And so far, what her interviews have shown is that the witnessing partner experiences a tremendous shift where they're now not blaming their partner, but rather having a lot of empathy or compassion, and that witnessing their partner work through their core pain, so to speak, or their shame, mobilizes care. And they somehow feel more prone to wanting to take care of their partner. And it enhances, just in general, for the person who's doing the self-soothing work, their responsibility personally to take care of the sensitivity in this wound. So that's it for my presentation. I'm aware of the time, and maybe I can just take 1 or 2 quick questions before we have to wrap up, and Angshwan talks about the upcoming training.
Yeah, so the floor is open. Who would like to raise any question? I would prefer that you say it or ask the question from where you are, but if you feel like you need to type in the chat, I'll be happy to read them out.
Ah, okay, so there will be a recording of this. And then there's a question about sharing the slides. I can certainly share the slides, and the recording will be made available.
Actually, Catalina, I do have a question.
Sure.
So, this is done in the context of self-soothing, but yet there's a partner that is sitting there. And in this particular video, Alex appears, or Kim appears to me that, his empathic is tuned in the way he's sitting, he's leaning towards and then hanging over the chair and all. And at one point, he was rubbing his eyes. I'm not sure
Yeah.
whether it's dry eye or he was feeling moved. And I'm just wondering if, inviting the partner to respond to that 12-year-old. I mean, how does that kind of even sound, even though this is done under the context of self-soothing and not other soothing? I'm just thinking if this could be combined. I don't know. What do you
Yeah,
think about
yeah,
it?
yeah. So I didn't show you the last piece, which is the integration phase where the therapist does a little bit of debriefing with the partner. And typically what we do is we ask the partner, so what came up for you as you were
Mm.
witnessing this? And usually it's so much compassion and sadness, and then we get them to verbalize, how they felt towards that wounded part, or in this case, the 12-year-old Alex.
Right.
And, and it's quite evocative and it's quite a bonding experience.
Mm.
And
mm,
sometimes there's even like, I mean, I've had situations where the other partner identifies with that partner's inner child and their struggle, or, there's also an imagination, almost a sense of, or they
mm.
develop a language of kind of joining each other or having these two inner children, so to speak, or their
Yeah,
wounded parts kind
right.
of stay together or
Mm.
comfort each other. So yes, that's the integration part. That's
Ah,
actually, we have to weave this work back into the
yeah,
couple's work,
yes. Mm,
right?
okay.
And so it's important to be able to both acknowledge that this is a part that belongs to this partner. So the therapist is really explicit about saying, so
Mm,
Alex, this is how you can take comfort, you comfort yourself.
right.
And also it's important for,
Mm,
she then integrates Kim by saying,
yeah,
and for you, Kim, to know that underneath kind of the
right.
prickly, irritable side,
Yeah.
there's a wounded part. Or I think
Mm,
Alex does this on her own. So
mm,
we carry the work forward, but
right.
certainly we want the compassion verbalized from the other partner.
Right, right. Okay, so it's both self-soothing and then other soothing at the next stage of the integration.
Yeah, yeah. I mean, yeah, exactly. So it's a supportive stance. I mean, we do this also it has so many benefits.
Yeah,
I was just
yeah,
having a discussion yesterday with some colleagues about it, and there's a lot of interest in actually eventually having all sorts of individual-based tasks happen
yeah,
in
yeah.
couples therapy because it enhances the bond, and it
Yes.
also makes people responsible for their own pain.
Mm, mm.
Anyway, so there's
Yeah.
a lot to be said for that.
Yes,
Mhm.
thank you. Thank you. I'm just going to wait to see if there's one more question. Otherwise, we'll begin to finish. Any questions for Catalina?
Last chance.
Yes. Otherwise, you have to wait till January.
Exactly.
Maybe could I
Yeah.
ask something? Hi, I really appreciate your sharing. It's really give me insight on how you can do with my couple clients. Like, because I have not been trained in EFT, right? I'm just wondering what about how do we help the avoidant partner to feel safe to show the vulnerability to begin with? Because when I try to do it, perhaps when I try to bring up potential underlying emotions, it they tend to deny it, or they tend to basically paste it over with something more cognitive. Yeah, so I'm wondering how we could create a space for the more avoidant partners. Yeah, thank you.
Yes, yeah, yeah. Excellent question, because this is so much what it's about in this approach. It's not enough to identify and acknowledge the vulnerability, you have to bring it alive. And remember, it's a process. So we spend so much of the therapy trying to get couples to just listen to each other, right? And to identify that there's something happening underneath. So it requires a lot of persistence on behalf of the therapist. And it really, repetition is so important. And trying to find the novelty in each repetition, because the cycle is something that we refer to consistently in the trainings, and in the theoretical framework, but people out in the world have no idea what you're talking about. And so being able to insist that, when you do X, I understand that underneath you feel Y, and the more you do X, the more you, other partner, feel whatever it is, and you do this. And it's in this process of both repetition and acknowledgement of vulnerability that people start to kind of, I think, move into a place where they can actually, start to get curious about what's going on for themselves and also for their partners. So it's a process, and you'll learn how to do this in January if you take the training. But it's definitely an experiential approach. So we deepen emotion once we have them de-escalated, and there's a whole art and skill set to doing that. Yes. Angshwan, do you want to talk about the training now?
Yes. So let me talk about the workshop that's coming up. As I'm doing that, I just want to take this opportunity to thank Catalina for taking your time to share this very interesting bit about self-soothing and also the integration and other soothing. So for those of you who are curious and want to learn more about this particular approach, EFT for couples, we have a workshop lining up in January. It's organized in 2 blocks. Let me go back to the slides. Over a period of 4 days in a week and then 5 days in another week, over a 3 hour period from 3 to 6 p.m. in the afternoon. Those are the things that will be covered. And there will be more information on our website if you're interested. And then a little bit more about what else we are doing in 2026. There are some of these workshops line up, the standard EFT module, as well as some other new modules such as EFT for groups. And one last thing before I end off is that we are launching a EFT community in the year 2026, where we not only offer discounts for workshop, but they would be learning activities, and then skills practice and also book study. So with that, I'm just going to stop share, and thank Catalina one more time for taking your time early morning in Switzerland for sharing with us. And we're looking forward to seeing you again in January in the workshop that we've just articulated. So thank you very much, Catalina.
Fantastic. Well, thank you for the invitation, Ingshwan and Caper Institute, and all of you for your participation and all the hands. Thank you. Thank you, Sophie. Yes.
Thank you.
I will see you hopefully in January. For those of you who are motivated to take this training, I really can't emphasize it enough. It will really change the way you work with couples. Good. So have a great day, everybody, and I'll hopefully see you soon. Bye.